Some cancers are so malignant that despite surgery, up to a third of people won't survive. But one Sydney surgeon has spent his career developing techniques to bring that figure down to just 1%. Professor Michael Solomon is recognised as a world authority. Our health editor, Dr. Andrew Rochford, scrubbed in on one of his operations to find out more.
Professor Michael Solomon is literally leading the world when it comes to some of the most complex cancer surgeries. These difficult surgeries aren't even attempted in other countries because they're considered just too difficult. Professor Solomon has been steadily improving the outcomes for his patients by just keeping them alive.
Mariana Barrick was 47 with 4 children. When she was diagnosed in 2000 with aggressive cancer in her pelvis, her prognosis wasn't good.
I was told basically that there wasn't much that they could do for me.
Then she was referred to Professor Michael Solomon at RPA Hospital.
And my husband asked him, is it because you think you can help, or is this a challenge for you? And he said, good question, a bit of both, yeah.
Tumours in the pelvis are difficult to completely remove because the organs are so densely packed together. Hitting a blood vessel can cause death quickly.
Why is it so complex, this surgery?
I guess the pelvis is a little bit like an LA freeway, as I explained to patients, is that you've got all these blood vessels, lymphatics, all coming in from the whole half of the body, and then you've wrapped that in a bony igloo, which gives us very difficult access.
Professor Solomon's radical approach is incredibly invasive and highly aggressive.
The main reason it wasn't offered was it wasn't safe. So I thought that was a surgical thing that we could address.
In serious cases, he removes all the lower internal organs during marathon 9-hour surgeries, and it works.
All of that inside there is the tumour wrapped in healthy tissue, so it looks good.
Professor Solomon performs about 60 of these amazing procedures a year. During this one, leading surgeons from Singapore, Malaysia and the UK assisted to learn his method.
It's really quality of life, survival and life really.
Life for hundreds of patients like Mariana, who 14 years later is cancer-free.
So many good things have come out of what I went through that I wouldn't care if I went through it again. To have the experience that I've had, it was amazing.
For patients with this type of cancer, surviving 5 years or more is considered a cure. Previously, only 10% made it. Now, because of Professor Solomon's surgery, 50% live 5 years or more. It is an incredible result. Next in my Healthy Truth series, I'll meet the boy whose heart stopped in a pool and how breakthrough research saved him and his mum. That's tomorrow.
Thank you, Andrew. For the first time in a decade, Myer has a new slogan to